Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a gynecologist talking to patient called Mrs. Kelly. You now have 30 seconds to go through the notes.
So, Mrs. Kelly, I have your notes here, but it would be good to hear things from your perspective, how all this started, what treatments you've had, anything you think I should be aware of.
Well, where to begin? I should explain that I'd been suffering with fibroids in my uterus for quite a long time, ever since my son was born actually, and he's at university now. So, I was used to a certain level of discomfort. You know, feeling bloated a lot of the time, getting the occasional bouts of heavy bleeding, and experiencing quite a bit of fatigue. Anyway, after a while, I also started to get pain in my lower back and pelvis, and that gradually got worse and worse. I was working as a preschool teacher in those days and had a young family of my own. It was a tough time. In the end, I had to give up my job. Anyway, to cut a long story short, I was eventually diagnosed with uterine fibroids. I was fairly lucky, I guess, as they hadn't caused major complications, but I was advised to have a hysterectomy. Although I was out of action for a while, it all went relatively smoothly. And, of course, it also sorted out my other problems, so for a while, I was relatively well. My kids were at school by this time, so I was able to start my own business, working online as a recruitment consultant. I'd put both the condition and the surgery behind me, and I was feeling very positive.
But then you started to develop other symptoms?
That's right. Those feelings of fatigue started coming back. I'd find I was exhausted after a full day of online meetings. If I did have to go anywhere and do anything, like attend the occasional conference, especially if involved in driving any distance, that would just wipe me out. So something obviously wasn't right. Anyway, I went to see the doctor, and he said that it sounded like I might have iron deficiency anemia, and he did some blood tests. But when the results came back, I was really surprised to find I actually had iron overload, and the next step was to test for hemochromatosis. And, of course, that came back positive. The first thing the doctor asked was whether anyone else in the family had ever had it, because it can be genetic. Anyway, I didn't know for sure because I was adopted as a baby, and I'd only recently traced my birth mother and started to get to know her. Anyway, she was able to confirm that some cousins whom I'd never met had indeed got the same thing.
I see. So, have you been having treatment?
Yes, I was told that the only option was venesection. That came as a bit of a shock, and I had it every week initially, then once a month, and I've been going every 3 months for some years now. I mean, it's fine. It hurt a bit at first, but I'm left with quite a bit of scarring on the arm where the needle goes in, but it's something I can live with. For the last few years, I've been back to my usual energetic self.
So, what brings you here today?
Well, I've started to develop some other problems, and I'd just like to have them checked out. I mean, I'm not getting any younger, so these could be completely unconnected with the blood problem. Anyway, the first thing is that I've started to get a bit of stiffness in my joints. It's particularly noticeable in my fingers, but I think it's there in my knees too. Then, I also seem to be getting more thirsty than usual, and it doesn't seem to be related to how much I drink. And the other thing is that I get a bit short of breath, sometimes, even when I haven't been doing anything particularly strenuous. You know, just walking the dog or washing the car, and it suddenly comes on. None of these things is a big deal, but I've just noticed the change.
End of extract 1. Extract 2, questions 13 to 24. You hear a GP talking to a patient, Mr. Melvin Joseph. You now have 30 seconds to go through questions 13 to 24.
So, Melvin, I understand you've been referred to me because you're experiencing some symptoms after recovering from pneumonia, and your doctors suggested that some physiotherapy could help.
That's correct.
I've got your notes here, but as we haven't met before, could you just run through for me how all this started, any treatment you've had, and anything else you feel I should be aware of?
Yeah, sure. It all started when I caught pneumonia. I mean, I hadn't been vaccinated, so maybe it was worse than it might have been, but who knows? Anyway, I had it pretty bad. I had the usual flu-like symptoms that turned into a nasty cough with lots of phlegm. It completely wiped me out. I never felt so sick in my whole life, but I got over it, and in time the symptoms pretty much disappeared. I was coughing for about a month, but otherwise I thought I'd beaten it.
I see. So, when did the current symptoms start?
I'd say like 6 weeks afterwards. The cough had gone, but I still wasn't feeling 100%. Looking back, the whole experience had, kind of, sapped my energy. I didn't feel like going to the gym like I used to do before because I was getting out of breath just doing ordinary things like carrying groceries. Then other stuff started happening. I wasn't sleeping properly, and so I was tired pretty much the whole time. Like, I'd wake up with a headache and it would go on all day, just get worse and worse, and that's when the other symptoms would kick in. Like, my brain would go kind of fuzzy, so I couldn't focus on anything properly, and I'd start to get this thing where I couldn't remember stuff, like words would be on the tip of my tongue but just wouldn't come out. I mean, that was weird. Anyway, at first, I didn't make the connection with pneumonia. I assumed something else was going on, and when I started to get palpitations and chest pains, I went to see the doctor because I thought it must be a problem with my heart.
Yes, of course. So, did you get a diagnosis and treatment then?
Well, I had all sorts of tests, including an ECG, and they put me on a heart monitor for 5 days. And that's when they said it was arrhythmia, and they put me on beta blockers. And I did start to feel better, like almost immediately. And they also said that my vitamin D levels were low and that I should take supplements for that, and that helped too. And they said this was all down to effects of pneumonia apparently, and I'm still getting some strange symptoms despite the medications, and that's why I've come to see you.
Okay, tell me about those, and how I might be able to help you.
Well, basically if I overdo things, like if I try to do too much or if I get anxious, then I start getting the symptoms again, mostly fatigue, but also a certain amount of joint pain, often in my hips, but it can also affect my ankles, even my feet sometimes. It's like a dull ache, and it seems to be related to the fatigue. I also get a certain amount of numbness in my fingers, which is a bit worrying. I mean, I still do quite a bit of exercise, but I mostly do gentle stuff like I've always done yoga, but I've also recently started doing Tai Chi, and that seems right for me. I would like to start going to the gym again, though I'm aware that I shouldn't do anything too strenuous. So, I was hoping to get some guidance on strength-building exercises. I mean, should I be using things like resistance bands or even trying light weights? It would be really good to do things like that, but I feel I need to do it under someone's guidance at the moment.
Yes, of course. Well, thank you for all that background, Melvin. That's really given me a good idea of what we need to do.
End of Part A. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a senior pharmacist is briefing nurses about new medication protocols. Now read the question.
Good afternoon, everyone. I'd like to briefly discuss the updated medication protocols that will come into effect starting tomorrow. These changes mainly affect how we administer antibiotics. For instance, the timing of doses will now align more closely with meal schedules to minimize gastrointestinal distress. Some of you may wonder about flexibility. Rest assured, there's leeway built into the protocol for patients who are fasting or on irregular diets. Just be sure to document any deviations clearly in the patient's chart and inform the attending physician. Also, let's remember that antibiotics, while essential, come with risks if overused or misused. Please keep this in mind when reviewing medications with patients, especially those who express concern about potential side effects. I'm confident these changes will streamline our approach and improve patient outcomes.
Question 26. You hear a ward manager addressing her team about hygiene compliance. Now read the question.
Hello team. I know hygiene protocols are second nature to us, but I wanted to take a moment to revisit a few points based on our recent inspection report. While our compliance rates are generally excellent, there's always room for improvement. One thing to consider is how we approach hand hygiene before and after patient contact. Are we making it a visible routine in front of patients? Sometimes that small act of visible care, washing hands or using sanitizer, can reassure patients about their safety. Additionally, let's not overlook equipment cleaning. Whether it's a stethoscope, a thermometer, or a blood pressure cuff, these items can easily become vectors for infection if overlooked. If you find yourself rushing during a busy moment, it's okay to pause and prioritize this. Our patients rely on us to set the standard for safe practices, and I know we are more than capable of meeting that expectation.
Question 27. You hear a head of physiotherapy addressing staff about patient exercises. Now read the question.
Good morning, everyone. I'd like to take a moment to talk about how we approach exercise routines for our patients, particularly those recovering from joint replacements. While we know the importance of mobility, we must also be mindful of individual limits. Pushing too hard, even with the best intentions, can lead to setbacks. Instead, let's focus on gradual progression. For example, if a patient seems hesitant, it might help to frame exercises as opportunities rather than obligations, highlighting how each step, no matter how small, contributes to their overall recovery. Lastly, consider the emotional aspect. Patients often bring their fears of pain into these sessions. A kind word or a little encouragement can often ease these worries. Let's continue to create an environment where patients feel safe to challenge themselves without feeling overwhelmed.
Question 28. You hear a patient and a nurse discussing post-surgery care instructions. Now read the question. I'm feeling a bit anxious about managing everything after my surgery. Could you go over the care instructions one more time?
Of course, I understand it can be overwhelming. Let's take it step by step. For the next 2 weeks, avoid lifting anything heavier than 5 kilograms to protect the surgical site. Remember to keep the wound clean and dry. Change the dressing daily, as per the instructions provided. If you notice any redness, swelling, or discharge, you must contact us immediately. Also, take the pain medications as prescribed, but let us know if they aren't providing enough relief.
What about exercise? I've been told walking is good for recovery.
Yes, walking is encouraged, but take it slow. Aim for short walks around the house at first, and gradually increase the duration based on how you feel. Don't push yourself too hard, though. It's okay to rest when needed.
Thank you. I'll make sure to follow these instructions. Question 29. A patient and a doctor discussing test results. Now read the question.
Doctor, I've been waiting anxiously to hear about my test results. Could you tell me if everything is okay?
Yes, of course. I understand your concern. The good news is that most of the results look normal. However, your cholesterol levels are slightly elevated. It's nothing to be alarmed about, but we'll need to work on it to prevent any long-term issues. I'd recommend some dietary changes, reducing saturated fats and increasing your intake of fruits, vegetables, and whole grains. We can also explore adding regular physical activity to your routine.
Does this mean I'll need medication?
Not necessarily. For now, we'll try lifestyle adjustments first and reassess in 3 months. If there's no improvement, we can discuss medication options. Let's take it one step at a time.
Question 30. A patient is seeking advice from a physiotherapist about back pain management. Now read the question.
The exercises you gave me have helped somewhat, but I'm still experiencing discomfort in my lower back. Is there something else I can do?
I'm glad to hear the exercises have been somewhat helpful. Back pain can be persistent, and it often requires a combination of approaches. For now, continue with the stretching exercises, but also consider applying a warm compress to the affected area for 15 to 20 minutes a few times a day. It can help relax the muscles. Additionally, pay attention to your posture, especially if you're sitting for long periods. Try to avoid slouching and use a chair with proper lumbar support.
I do spend a lot of time at my desk. Would standing breaks help?
Absolutely. Standing up and moving around every 30 minutes can make a significant difference. Gentle movements like walking or light stretching during breaks can also help ease the tension in your back.
End of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a presentation by Dr. James regarding color blindness. You now have 90 seconds to read questions 31 to 36.
Hello, I am Dr. James the First. Have been working with patients having color blindness for the past decade. Today I am going to talk about my work, color blindness and patient experiences. Let me start with brief introduction about color blindness. Color blindness is a common disease affecting a significant portion of the world's population. While not life-threatening, it has a profound impact on how people perceive and communicate with the environment. The nature of this disease is what makes it difficult to manage because most people tend to think it is not a serious disease because it is not a danger for life. However, I beg to differ. For colorblind people, distinguishing some hues can be a constant challenge. This can have an impact on the choice of career, since some competitions, e.g. graphic design or electrical installation, precise color differentiation is required. Everyday tasks like cooking or choosing clothes become more complex when color comes into play. In addition, color blindness can lead to moments of frustration and misunderstanding in social interactions. Misidentifying the color of objects or clothing can cause embarrassment or discomfort. The personal narratives of the individuals living with color blindness provide a profound insight into their daily experiences and challenges. Their stories showcase the resilience and creativity that can emerge from navigating a world that predominantly relies on color perception. Meet Chris, a dedicated teacher whose journey in education has been shaped by his unique perspective as a colorblind individual. His story sheds light on the challenges he's faced and the innovative strategies he's employed to make learning accessible to all students. Chris's career in education began with a passion for sharing knowledge and making a positive impact on young minds. He soon realized that being colorblind presented particular challenges when teaching young children about colors. One of the strategies Chris uses is associating colors with feelings or objects. For instance, he might describe the color red as the color of a fire truck or the feeling you get when you're excited. By using relatable associations, he helps his students understand and remember colors more effectively. He has transformed challenges associated with color blindness into opportunities for innovation and creative teaching methods. Another patient, Kelly, a college student, for her, the seemingly routine tasks that most people take for granted can become daily hurdles. One of her ongoing challenges is grocery shopping. She often relies on the feel of the produce and the advice of store employees to make sure she is getting the right items. It's a small inconvenience, but it can be frustrating. Navigating maps and interpreting color-coded information can be a real challenge for Kelly. She's quick to emphasize that while color blindness presents challenges, it also encourages adaptability and creative problem-solving. Ethan, a talented graphic designer, has a unique perspective on color blindness and how it has influenced his career choices. For him, the journey has been about discovering strengths in unexpected places. Ethan's fascination with design began at an early age when he started experimenting with art programs on his computer. As he honed his skills, he began to notice subtle differences in the colors he used compared to what others saw. Eventually, he realized that he had a form of color blindness known as red-green color blindness. Initially, Ethan was apprehensive about pursuing a career in graphic design. The field is known for its emphasis on color theory, and he worried that his condition might limit his success. However, his determination and passion for design led him to explore unconventional avenues within the field. Ethan's unique perspective as a colorblind designer has led him to focus on aspects of design that are often overlooked. He excels in areas such as layout, typography, and user experience, critical elements of design that don't rely solely on color. Sarah, an artist with an undeniable passion for her craft, shares a deeply personal aspect of her creative journey. Her love for painting is unwavering, yet her unique way of perceiving colors introduces a layer of complexity to her artistic process. This distinct perception often requires her to seek external help to ensure the colors she uses align with conventional standards. While this necessity can sometimes be a source of frustration, it also serves as a catalyst for innovation. Sarah's unconventional perspective on color has become a hallmark of her artistry, enabling her to craft strikingly original pieces with unusual color palettes that capture attention and ignite curiosity. These artworks stand as a testament to her ability to transform a perceived challenge into a distinctive advantage, celebrating the beauty of individuality in the creative world. Through her perseverance, she demonstrates that art is not merely a visual expression but also an intimate reflection of personal experiences and perspectives. The personal narratives of these individuals living with color blindness provide a profound insight into their daily experiences and challenges. Their stories showcase the resilience and creativity that can emerge from navigating a world that predominantly relies on color perception. While color blindness may present hurdles, it also highlights the capacity of individuals to adapt, overcome, and even excel in their chosen paths. These stories remind us that diversity, including diversity in perception, is a beautiful aspect of the human experience and should be celebrated and accommodated in our society.
End of Extract 1. Extract 2. Questions 37 to 42. You hear an interview with Dr. Mark about Menkes disease. You now have 90 seconds to read questions 37 to 42.
Good afternoon, Dr. Mark. Thank you for joining us today to discuss Menkes disease, a rare and complex condition. Could you start by explaining what Menkes disease is and how it affects individuals?
Thank you for having me. Menkes disease, also known as kinky hair syndrome, is a rare genetic disorder that affects copper levels in the body. It is caused by mutations in the ATP7A gene, which is responsible for the transportation and regulation of copper. Copper is essential for many enzymes involved in brain development, energy production, and connective tissue health. In individuals with Menkes disease, copper fails to be absorbed properly and accumulates in some tissues while remaining deficient in others. This imbalance leads to severe developmental delays, neurological issues, and characteristic features like sparse, kinky hair. The disease predominantly affects males, as the ATP7A gene is located on the X chromosome. Early diagnosis of Menkes disease is clinically very challenging because of the subtle clinical features and nonspecific biochemical markers. The rarity of this disease is responsible for lack of awareness among clinicians.
That sounds incredibly challenging for families. How rare is Menkes disease, and are there any specific populations that are more affected?
Indeed, it is an uphill battle for those affected. Menkes disease is as rare as finding a needle in a haystack, with an estimated incidence of 1 in 100,000 to 250,000 live births. It doesn't discriminate and can cast its shadow over any ethnic or geographic population. However, because it's so few and far between, many healthcare providers go their entire careers without crossing paths with it. Interestingly, in some isolated communities where marriages between close relatives are more common, the condition pops up slightly more often, proof of how genetics plays a key role in its occurrence.
What are the symptoms that typically lead to a diagnosis of Menkes disease?
Symptoms usually become noticeable within the first few months of life. Early signs include poor feeding, irritability, seizures, and developmental delays. The characteristic hair abnormalities, such as sparse, brittle, and kinky strands, often prompt a closer investigation. Over time, children may develop muscle weakness, low body temperature, and other signs of systemic copper deficiency. Unfortunately, these symptoms are nonspecific, and diagnosis is often delayed. Genetic testing to identify ATP7A mutations and measuring copper and ceruloplasmin levels are key to confirming the diagnosis.
Is there any treatment available for Menkes disease?
Copper histidinate injections represent one of the key therapeutic approaches aimed at addressing the challenges posed by certain genetic disorders linked to copper metabolism, such as Menkes disease. These injections are administered in cases where copper transport within the body is impaired due to a genetic mutation. Research indicates that administering these injections within the first few weeks of life can have a meaningful impact, particularly in terms of preserving neurological function. The brain and nervous system are highly vulnerable to the effects of copper deficiency, and early intervention may mitigate or reduce some of the irreversible damage that often occurs during critical developmental stages. The timing of treatment is paramount. Delays in diagnosis and intervention can lead to severe and progressive neurological impairment, as the damage can become permanent early in the course of the disease. This emphasizes the importance of newborn screening and prompt action to ensure timely delivery of the therapy. In addition to copper supplementation, supportive care is vital for managing the symptoms and complications associated with these conditions. The collective opinion within the medical community underscores the urgent need for early diagnosis and intervention.
It must be emotionally overwhelming for families. How can healthcare providers support them?
You're absolutely right, it is an emotionally taxing journey. Healthcare providers can play a crucial role by offering compassionate care, connecting families with support groups, and providing clear and comprehensive information about the disease and its management. Early genetic counseling is also essential for families considering future pregnancies. In my opinion, empathy and open communication are just as important as medical expertise in these situations. Empathy helps healthcare providers connect with patients on a human level, showing understanding, patience, and respect for their unique emotional experiences. Open communication ensures that families feel heard, valued, and involved in their care decisions. Ultimately, a holistic approach that combines medical expertise with emotional support can profoundly improve the quality of care and the overall experience for patients and their families. By fostering trust and understanding, healthcare providers can help individuals find strength and hope, even in the face of adversity.
What progress has been made in research on Menkes disease?
Research is progressing, though slowly due to the rarity of the condition. There has been significant focus on developing better diagnostic tools and exploring the potential of gene therapy. Some studies are investigating ways to deliver copper directly to the brain, bypassing the defective ATP7A protein. International collaborations and patient registries have been crucial in advancing our understanding and treatment options. While progress may seem incremental, every step brings hope for affected families. One major challenge is the lack of awareness, which often leads to delayed diagnoses. Additionally, funding for research on rare diseases is limited compared to more common conditions. As a result, developing effective treatments is a slow and expensive process. There's also the psychological burden on families, which healthcare systems sometimes struggle to address comprehensively. Advocating for increased funding and awareness is key, in my opinion, to overcoming these hurdles.
End of listening test. You now have 2 minutes to check your answers.